Welcome to Public Health Matters, the show that addresses public health issues that matter the most to the citizens of Harford County. Real issues, real people, and the information you need to know.
Hello, I'm Molly Mraz, Public Information Officer for the Harford County Health Department and your host for today's Public Health Matters. It's the show that takes a closer look at the public health issues that matter the most to the citizens of Harford County. According to the CDC, health equity is achieved when every person has the opportunity to attain his or her full health potential, and no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances. Joining me today to talk about health equity is Harford County Health Officer Dr. David Bishai and internist and holistic health coach Dr. Philip Halstead. Welcome to our show, and thank you so much for being with us today.
Pleasure.
Thank you.
Dr. Halstead, let's start with you. Kind of give me just a little bit of background.
Well, I have a background of 31 years of integrative medicine practice where I combined internal medicine plus natural remedies together. I did that for 31 years, and in the last 2 years I transitioned to health coaching, which has kind of a totally different emphasis where it really puts the patient or client at the center of their health care and puts them in control of improving their health. And that has kind of a whole different ramification to it, and I really enjoy it.
Good, very good. And kind of you assist in making sure they get the health care that they need versus, and becoming health equitable, right?
Absolutely.
Very good. Dr. Bishai, how about you?
Sure. So before I became a health officer, I was a professor at the Johns Hopkins School of Public Health, where I was a specialist in economics of health. And a lot of my research was on how to measure the disparities and the equality of health outcomes. And one of the things I discovered throughout my career was that public health interventions are one of the best ways to narrow health gaps between populations. Vaccines, micronutrients like vitamins and better nutrition, they actually help lift up the disadvantaged to create health equity. So as a public health officer, I'm really excited to be in a position where I can help Harford County address the health inequalities that it's been experiencing.
Right. How would you define health equity?
Well, health equity, you read the description. Health equity is the making sure that opportunities are the same among all groups of people. Nature makes us very unequal even at birth. There are genetic and factors that cannot actually be equalized, but the opportunities can be, and as a society, America is built upon the promise of treating everybody equally and equalizing opportunity. That's what we mean by health equity.
Mm-hmm. And would you say you have a different definition?
I have the same definition, essentially. I think really health equity is a matter of really removing barriers for people and making sure that, as opposed to health equality in my mind is something that gives everyone the same thing, but the thing is that may not be enough. Mm-hmm. There may be some people who actually need more. So health equity is really tailored to each individual, and that health care that they get really is tailored to their needs, which may be something more than the next person or something maybe not as much. So, but it still evens the playing field, but it just gives different levels of care and access to.
There are a lot of words that I feel like are kind of hard. I mean, unless you're in the health field, they're kind of hard to conceptualize, like health equity, I think, being one, health equality, health disparities, and health inequality. So when we talk about health disparities, Dr. Bishai, how is that different than health inequality?
Well, when we're talking about disparities, we're far down the road of trying to measure what's going on. And a disparity is a group 1 versus group 2 comparison. And you can compare obstacles, you can compare who's getting care, you can compare what's happening at the end. What is the difference in disease rates and in death rates? And once you're comparing group 1 to group 2, you can say, I see a disparity. Things are not coming out the same for the two groups.
And does one group have a higher outcome than another group?
Correct.
Okay.
Correct. And it's often the groups are things that matter to people. Mm-hmm. Gender, race, sexual orientation. Often sometimes belief systems can lead to disparities, and we're seeing that right now with COVID, that belief systems can create disparities in what's happening with COVID.
What do you see, you as health officer for the health department, and then I'll turn to you, Dr. Halstead, as health disparities right now in Harford County and what we're kind of dealing with?
Well, so when I came to the county, wasn't coming with a blank slate. We knew from past research in America that race has always been one of the biggest things that creates disparities. We know this throughout all states and all counties, and so we came to Harford County to look at what is the size of the health disparity in the county and what's causing it. So we finished looking at our death rates in the county, and we found that the life expectancy for the African American population in Harford County is 1.4 years shorter than for the white population. The good news is that that disparity has shrunk over the last 15 years. It used to be 3 years. Now it's down to 1.4 years. Why it shrunk is something that we can get into later, but we'd like to see what factors are holding that disparity still to the present day. Why is it that being an African American in this county is holding your life expectancy down by 1.4 years? It's like one group is having its own COVID pandemic every year for the last several hundred years. They've just, the black body isn't genetically different. It's the way that black body is treated that has somehow led to this change in life expectancy, and that's what we need to explore.
Right. And then, so what do you see in your line of work with health disparities?
Well, similar to what Dr. Bashai was saying, I think it really has its root in race and the way different races are treated. And really it's kind of has its roots in racism and discrimination. And health disparities or health issues where there's lack of fairness in achieving health care has its roots in that. It's a symptom of a problem. It is a problem, but it's not a standalone problem. It has its roots in that whole racist attitude, and that's what really needs to be changed. And it's a tough thing to try to deal with. I think it has a lot to do with the mindset of people, and it's almost like when we deal with health disparities, it's like we're dealing with like the 25th floor of a building, whereas the racism is at the foundation. So we work hard to try to work with alleviating barriers to health discrimination, but we're up on the 25th floor. We're not at the base. The base of the building and the foundation is that whole kind of racist and discriminatory practices, and those are the things that really need to be really focused on and worked on. If we can get the foundation strong and get that cleared up, then a lot of the upper floors will kind of start to gel. I mean, there are things that we can do, governmental-wise and things of that sort to help with disparities. But unless we really get to the underlying root cause of things, those are just going to kind of end up being like Band-Aids. So I really think that all of this really has its roots in that racial and discriminatory practices for so long. And that's really where we need to kind of start to work with.
Right. And so how would you, like, in an ideal world, how would you be able to change that foundation? I mean, would you start with, is it starting from government and legislation, or is it really just, boots on the ground in the community trying to change?
In my mind, it would be more boots on the ground and trying to work with society first, because society is what's being affected by the disparities most. So I think that the solution really needs to start to work there. And it really needs to work at, working with our young people, our children, in getting them more exposed to each other and each other's cultures, so that when they get older, it's not like culture shock to them. If one ethnic group kind of resides here, one ethnic group resides here, and they learn to function and to learn their values within that group, but then when they get older and realize that there are other people out there, it's tougher sometimes for them to really understand what the experience of that other ethnic group is.
Right.
So my thinking is that it really needs to start really fundamentally, really needs to start early in childhood, just trying to get kids to really understand that there is more to society than just them and just their immediate surroundings. It's exposure. A lot of it just has to do with exposure to each other and other ethnic groups, other cultures, and then that becomes part of their upbringing, becomes more incorporated as opposed to something that's really like has to be artificially done when they get older.
Right. And that's hard. I mean, you look at Harford County like zip code data, and where, minorities would be, according to Harford County, in, Bel Air, that's like a predominantly white community, and then, along the Route 40 corridor, which tends to be a little bit more diverse down there, it's kind of like, it's just so hard to be able to merge the communities and really help people identify that these are like huge discussions that need to be had, and being able to expose children and adults because you've seen it. I'm not telling you anything you don't know, but so the health inequities, and then they essentially can produce poor health consequences, right?
That's right.
So can you just talk a little bit, Dr. Bashai, about how that equates to each other?
Sure. So when we did our study of the disparity between blacks and whites, we found that there was 1.4 years of life expectancy. We asked what diseases were creating that gap, and we found without any doubt that it's really heart disease and strokes, cardiovascular diseases, blockages in the arteries in the heart, blockages in the arteries leading up to the brain and inside the brain. Those blockages come from plaque formation, and they're more prevalent in the black population, leading to that gap. How does that happen? Well, we all know that cholesterol, blood pressure, diabetes, lifestyle is part of it, but there's more. Part of what forms plaques can come from a stress response. When the body's under stress, it releases adrenocortical steroids. Cortisol can create plaque formation. Further stress comes from adrenaline, and that stress response can lead the body to secrete adrenaline. So treating somebody poorly, pushing them down, and denying them opportunity daily, day after day after day, come home from work after another miserable encounter, it leads to accumulated stress in the body. It leads these stress hormones to lead to plaque formation in the arteries. If you couple that with not having access to information, to good food, to ways to exercise, to good counseling on how to control the blood pressure, you got a double whammy. You have a stress response leading to plaque formation in the arteries, and you lead to the denial of the means to lead a healthy lifestyle. And it can start even as early as infancy or even before. We have evidence that the way pregnant women are treated can lead them to change the chemistry of their fetus and pre-program them through a process called fetal imprinting that can lead a newborn baby to be programmed to be more likely to be stressed and have the stress response I just referred to.
It's scary. So many things that the mother can do and not even realize.
Well, also what we can do to mothers. If we create a supportive, nurturing experience for a mother, and we make them feel loved and accepted in the community, that can undo that same process I spoke of. And we have programs like doulas, and we have many prenatal care opportunities to reach out to moms that are having a hard time during their pregnancy to try to counteract some of what could go on.
Right. It's, the assumption of my healthcare experience, well, why wouldn't that be the same as, an African American mom? Like, we're both women, we're both, if, we both are pregnant at the same time, how come her health experience would be different? You can't imagine a healthcare provider who their job is to help someone and give them the best medical advice, that they would be treated any differently. But I'm sure you've seen it in practice, and I'm sure you've seen it at the emergency room. It's just kind of, you can't believe we're still here today after so long of trying to fight for equality. It's just something we need to work better at. What's been done? So you said that the life expectancy went from 3 years less to now we're at 1.4 years less. So what's been done to kind of help?
So This is something a little bit nuanced. The gap closed from 3 years to 1.4 years. Part of that closing was that there were improvements in both the white population and the black population up until around 2010. Going into 2010, we reached the last 10 years has been a really sorry story for everybody because of lifestyle, opioid deaths, and suicides and alcohol use. Those diseases of despair, diseases where somebody feels like they're having a hard time in life, happen to both blacks and whites, but it did affect the white population more. Diseases of despair affected the white population more, and so there was a sort of a period where life expectancy stopped increasing starting in 2010 in Harford County, and there was a decline in life expectancy for the white population. So I wish I could say that the last 10 years has been great progress for blacks that closed the life expectancy gap. It wasn't that way. It was an increased mortality in the white population. And we have to do both. We have to address the diseases of despair in everybody, in blacks and whites. But that gap is still there, and that gap is a cardiovascular disease gap. So while we've been working on the opioid crisis, alcohol addiction, and suicides, we're going to keep working on that because that's what slowed down progress for everybody. But we need to go back and say, what is holding back? Why do we have higher rates of blood pressure, problems with lifestyle and diet that is much more prevalent in one population, in the African American population? We have to address that.
And so why do you think that is?
So,
like the deeper rooted, not just diet and exercise and things like that, but, talk about that on a deeper level.
So the problem with blood pressure is twofold. Getting the disease of blood pressure, getting high blood pressure, I referred to having disrespectful and stressful experiences in your life, and there we have the agenda of treating everybody equally and the same, and that's something we have to commit to. But after you've been diagnosed with high blood pressure in the African American community, we're not doing everything we can to get it under control. We're finding that almost half the time, you know you have high blood pressure, you have the pill bottle on your bedside table, and your blood pressure's still not under control. So primary care doctors like Dr. Halstead have that problem every day. Let's check your blood pressure. Let's see what we can do to get it under control. Let's try more diet, stop the salt intake, exercise more. But Dr. Halstead can't see people often enough. We need more blood pressure cuffs in the home. We need blood pressure awareness out in the community. We need people, if you have high blood pressure, Molly, you should be taking your blood pressure cuff out every day and writing it down in a log. When you're fulfilling your prescription with your pharmacist, show your pharmacist your blood pressure log. Call your doctor in between time. Know yourself that if you are not meeting your target blood pressure numbers, getting a systolic blood pressure under 140, you need to get it under control. It's your body. So that empowerment of I need to know what my blood pressure number is, I need to get it under control, is something we can do better at. We must do better at. And I don't want to put all the burden on the provider. I'd like the community. I'd like everybody, the church pastor, the deacon, the barber shop, the bus driver. What's your blood pressure, ma'am? Why not? Why can't that be the new greeting in Harford County?
You should patent that. Go ahead.
Instead of
make a YouTube
no, in China, they don't say hello. They say, "Have you eaten?" Right?
Right.
Very food oriented. Why can't we say, "What's your blood pressure?"
Right.
That would be a great way to say, "I love you and I care about you. Welcome to my life."
Right.
Just to piggyback on what Dr. Bashar just said, I mean, I think he said a key word there, and that was empowerment. And a lot of what happens is people tend to feel disempowered, okay, particularly in the minority community. We feel that, we are just cogs in a wheel. We don't really have that understanding. And sometimes what happens is, even with providers, even well-meaning providers, they may just not be as culturally aware of how to really approach a patient, an African-American patient, for example. And that interaction can kind of cause friction between the doctor and the patient, where the trust isn't built up, or the desire to be compliant with therapy isn't built up. And then you start to combine that with things like, the neighborhoods, just the way the neighborhoods are set up, where there's not adequate good food. There's fast food places on every corner. Obviously, there's stress all the time. The neighborhoods aren't the safest that they can be. So that just adds stress. It adds dietary non-compliance. And when you add that in with the patient not necessarily trusting the doctor completely or trusting in what they're being treated with, then that cuts back on medication compliance, and that adds to the problem too of, for instance, controlling blood pressure. But that could be for any kind of health problems, diabetes or anything else, cholesterol. It's all kind of the same thing. So it's kind of like there's a lot of kind of variables in there. There's social variables, and then there's economic variables, there's environmental variables that are all kind of coming into play.
You think that it's just one thing that you can fix, but it stems from so many other issues. And like access to care, you know, if trust is such a big component to relationship building with your doctor, and if you don't trust your doctor, you may not go back to see them again. But one question I had is like, if you don't know where to find your information, like you don't know where to look to find reliable, factual information about your health, and you know where to find a trustworthy physician. Like, how do people get that information? How can we expect people to take control of their health if they don't have the resources for that to happen?
Well, again, that's a big problem, and I think what we have to do really is try to arrange for those resources and get those resources to the people, not necessarily try to get the people to the resources, but bring the resources to where the people are, okay? Bring the resources to the neighborhoods. That's why, you know, mobile vans and things like that, or blood pressure checks in the community, going to where they are, and that's a first step, because you're not asking them to really travel somewhere else that they may not be able to get to. You're actually going to where they are.
Right.
And that's a big key. It's just going to where the people are, starting where they are with what they have, and doing what we can to try to, you know, start to get their health on track and get that information. Knowledge is key. You know, understanding what's going on with a person's body. I mean, you could talk. I've had conversations with patients, and the stories that they tell me, I ask them kind of to give me like a understanding of what they feel is going on in their body, and what they tell me is just something that's totally way off from what is really going on. And it just shows you how people just have different ideas of what's happening, and they may not have the right information. So the key thing really is to go where the people are. You know, the churches, shopping malls, wherever, you know, wherever people are, and try to get in, you know, kind of get your tentacles into the community that way. That way you can provide information, and then they hopefully will be able to come out of where they are and be able to access health care a little bit better and with more knowledge, because knowledge takes fear out of things too. When people don't have knowledge, they become afraid.
Right.
And when they become afraid, they back up and they withdraw. So knowledge is key to everything, and just understanding that people aren't as knowledgeable as you may think they are,
right.
You know, and there's nothing wrong with that. What's wrong with it is if we don't fix it.
Right.
Yeah.
And to make sure that you treat them with the respect, and not make them feel stupid just because they don't know something that, you know, you deal with on a, you know, and you went to school for, you're educated in, and everything. Dr. Bishai, what are some ways that the health department is addressing health equity?
Sure. So starting in March of this year, we were able to start a community health worker program. Like Dr. Halstead said, getting out to the community is critical, getting those messages out there. What a community health worker is somebody who is not in their office. They are out on the streets, in the churches, in the Boys and Girls Clubs. And so our two community health workers are out in the Route 40 corridor every day. They're knocking on doors. We know that door knocking is not what it used to be. People used to open their doors. We do. We still try. Over time, I think people will get to know us and know that. The community health workers are holding healing sessions for people to come out, and they're promoting the diabetes prevention class where people can take advantage. The hospital is partnering with us. The hospital has the similar community health worker program. We want to expand that. There's so much more to do to get the word out, and to over time build those relationships and the trust with the members of the community. We're working with churches and We're also working with our retail pharmacists. We're hiring a new intern starting next month who is going to visit every retail pharmacist and ask the pharmacist to be part of this, get the word out, because people see their pharmacist more often than their doctor.
Right.
And pharmacists are part of the team. So we will be using the pharmacies of the county as a way to send out health messaging even more.
That's great. That sounds like excellent work, and we've been working with the community health workers, which is how we were introduced to Dr. Halstead, and it's just brought such a kind of a sense of community within that community, and the healing sessions have they've had a great outcome, and hopefully more good work to come. What are you personally doing with your business to help close that gap a little bit?
Well, I think what we do as health coaches is we first of all, we find out what matters to the individual. Okay, we ask them, we say, what matters to you? What gets you out of bed in the morning? What's the most important thing to you? And many people have not even been asked that question before, and they're puzzled by the question at first. They may not have an answer right away. It might be in subsequent visits that they come up with the answer. But just knowing what their goals are. So somebody might say, the most important thing to me is playing with my grandchildren. Okay, so that's great. And then I'll move on to say, well, how's your health? We'll kind of go through different areas of their health, their surroundings, their food that they eat, their spiritual life, all different aspects of their life, and find out what's working for them, first of all, and then we kind of find out what areas aren't working for them as well, and find out from them what they want to really try to do to help improve that. And we try to always relate it back to their goals. So if, say, somebody is having issues with their food and drink, they're not eating healthily, and we say, well, if you don't eat healthily, you're not going to be able to play with your grandkids because you're going to get sick. So that kind of gives them a kind of a food for thought, saying that this is really important for them. But the whole idea really is to try to empower them to make those health changes so that they can really be able to enjoy what really matters to them. But to have them be in control, have them to make the decisions of what they want to do and where they want to go. And we as health coaches work side by side with them and help them along the way. We don't lead them or push them, we walk with them side by side. And that's empowering to them, and it equips them with the knowledge and the confidence that they need to really make these health changes that they need in order to really be healthy.
And you said empowering, that's like the word of the day, right?
Yeah.
We are out of time, but I appreciate you so much being here today because it's such an important conversation to have. And continue what you're doing. It's great work. Dr. Bashai, great work for you too. And thank you so much to our guests today. That's all the time we have for today. Dr. Halstead and Dr. Bashai, thank you so much for being here. If you would like more information on health equity, please refer to the resource page after this program and join us next time for another important health issue that matters the most to the citizens of Harford County. Thanks for watching.
You've been watching Public Health Matters, brought to you as a public service by Harford Cable Network, your county connection.